We're here with Dr. Orlando Nunez at the helm today, and I'm taking the back seat so I can show the world what exactly we do here in respect to minimally invasive surgery. Today we have a patient who actually, she actually, like that, she has, number one, an overriding right second toe over the great toe. Number two, patient has a hammer toe deformity. We're going to go ahead and straighten the toe. Okay, number one. Number two, correction of the hammer toe deformity. Everyone can see from the side view here, right? And number three, once we actually, we're going to also fix what we call the little mallet toe, the claw toe. A lot of people have that. So we're going to go ahead and straighten that out. And I think that we may not need to, well, we're going to, I guess we'll play it by ear. So without further ado, you know, these procedures, I'm going to go ahead and kind of narrate through the process. I'm not going to use big words here. I'm just going to use very simple to understand words. And this is basically a step-by-step process. I've said it before and I'll say it again, not all surgeons are created equal. Please do your homework. This is not a walk in the park. These are very intricate, delicate, and fragile procedures. You know, at first glance, a lot of people think that, oh, let's just go ahead and try to perform these minimally invasive, you know, procedures, surgeries, and it's just not like that. It's just not like that. When we talk about incisions, I mean, we don't even have to, I don't even know where my finger is, but there it is. You don't even need a stitch there. But you guys are going to see how, I mean, going to Disney World, there's magic, but this is better than Disney World. So we're loosening up, we'll say, the soft tissue structures, and as everyone can see, the toe is already straight. Right? We're trying to get that toe into a more rectus, right, straight position. So through the bottom, and again, I can't move to the bottom now just because I'm set in respect to how I'm sitting. Tiny little incision on the bottom. To release another important structure. As everyone can see, the toe is now, we're slowly getting there. You know, this is a step-by-step process. So now, again, through the same little incision that was previously made, I'm going to go ahead and make a little bone cut. I'd like to go back to what I was saying before. Historically speaking, you know, you have the open traditional approach. A lot of that, I would say 98 to 99% of the surgeons these days, that's exactly what they do. Which is, you know, the large incisions, the pins, the screws, maybe some implants. It really depends, doctor's preference. This is totally, completely the opposite of that. We don't use any pins, any implants. These are, you know, as everyone is, you know, clearly seeing, these are tiny little incisions. Some need a tiny little stitch. Some don't even need a little stitch. But what I want everyone to really appreciate is the intricate work. It's so much easier. There's no question. It's so much easier to have the toe, you know, have a large incision on the top, right? Several centimeters long. You can see everything. See, look at this. Look at, I mean, I want everyone to simply look at the right before your eyes. The toe is completely and totally straight.
And short.
And shorter, absolutely. So when we talk about beauty and function, again, the toe we have realigned.
I'm gonna put one stitch right here.
We're just going to put one tiny little stitch underneath. Okay. When we talk about, correction of structural deformities, we're just not, yes, we're correcting the problem. That's the function. And then we're also correcting the aesthetics. That's the beauty. But the toe, we don't want the toe like a straight arrow. We want the toe with a very natural appearance. So whether it be males or females, when you wear those pretty sandals or nice sandals, the toe will look natural. Put another tiny little stitch on the top. And again, I would highly recommend my partner here in crime, Dr. Orlando Nunez. I highly urge everyone to follow him on his Instagram page. He just recently launched it. CDA foot ankle, Charlie David Abraham foot ankle. You guys are going to see a lot of incredible transformations there. And just like that. And just like that. You see, it is much better than Disney World. The magic that happens here, you can't find at Disney World. This toe is now completely and totally straight. Hammer toe is gone. And the toe has been shortened by default. And if anyone is wondering, well, Dr. Wagner, what about the third toe? We're going to go ahead and, again, using a little one stitch procedure, which we're going to definitely, of course, film, because the world wants to see Dr. Nunez in action. I'm going to give everyone a different view now so you guys can really appreciate once he's done here. This is absolutely beautiful. Absolutely jawsome. So now I'm going to come through the side just to show everyone what a mallet toe is, right? So look at the third toe. You see how the third toe, exactly, thank you, doctor. So we want to bring that little tip just like that. Like that. Okay, right now it's moving down. The nail's kind of curling down. The whole toe's curling down. That's what they call curly toe, claw toe. So without further ado, we'll let Dr. Nunez continue the again. Intricate, delicate, fragile. Dr. Wagner, how does he know where he's cutting or what he's cutting? It's called experience. Something you can't teach. And just like that. Bingo.
Look at that cute foot.
So, Dr. Wagner, what happens now? Right? There's no pins. How do we hold the toes in the proper position? We implement really robust, special splinting techniques to hold everything in place during the next several weeks, to hold everything in place while everything heals. 3, 4, 5 days, all the sutures will come out. That's it. And believe it or not, after about a week or so, maybe a little bit more, sometimes we even recommend the patients can go back into, let's say, Birkenstocks, sandals. Crutches? Forget about it. So now I'm going to ask the patient, how was the experience, just in general, right? People want to know. Well, the patient is wide awake. This is performed under local anesthesia. How is it, right? We're not done, but we're almost done. How has it been?
Fascinating and painless. Interesting, very interesting and painless.
The beautiful thing is a lot of doctors, and this is, I speak the truth, a lot of doctors would not be very happy knowing that the patient is actually watching them do this pretty much like live, right?
Absolutely.
You're watching the whole thing. A lot of doctors don't like that and would not like that. But we don't mind whatsoever. Some patients, if they're able to handle it, that's fantastic.
There's almost nothing to handle. There's little teeny tiny holes. Hardly any blood. There's nothing to handle.
Agreed. So, absolutely gorgeous.